Hello, you're welcome again. This is your friend Nurse Pollution. Let's talk about what to do if bleeding occurs after anal sex. It is essential that if bleeding occurs after anal sex, to take immediate action to ensure your physical and emotional well-being. So let's talk about the step-by-step on what to do if bleeding occurs during anal sex. What do you want to do? The first thing is you take immediate action. You have to stop the sexual activity immediately. Stop any further sexual activity to prevent worsening the bleeding. That's the first thing. And you should know that you have to stay calm. Remain calm and composed. Don't be anxious. To think clearly so that you will be able to know what to do. You understand? At times, being anxious clouds our thinking. You understand? Being afraid of something clouds our thinking. And number three, you should assess the bleeding. What's the severity? What's the quantity? Is it heavy? Is it rapid? Is it accompanied by severe pain? If it is, you have to seek medical care immediately. But before then, there are some things you can do, like cleaning yourself up, cleaning the area gently with maybe soap, with soap and mild soap and water. You understand, to prevent infection. You can apply a cold compress, like an ice pack or something, wrapped maybe in a cloth or a gauze to reduce swelling, or a handkerchief or something to reduce swelling and knees pain. And of course, apart from that, you should be able to, you can, if time permits, you understand, or you are in a difficult place, you can take a warm bath, soak yourself in a warm bath to help relax the muscles. And of course, this will reduce pain and of course, discomfort and of course, the bleeding, of course. Then after from that, you want to seek medical attention. Seek medical help if the bleeding persists or is heavy or is accompanied by severe pain. You can visit your primary care physician, a sexual health clinic, or even emergency room. And the in thing is that you should be able to open up to them so that they will know what to do for you. So you have to get tested for STIs if you are not in a monogamous relationship or you have concern about sexually transmitted infection. Get tested as soon as possible, right? And when we're talking about anal sex, next time you want to do it, there are some things you want to do. Inform your healthcare provider about the bleeding or any other symptoms accompanying it. Of course, likely they might perform physical examination, of course, take your medical history and guidance on further testing or treatment. That's the reason I said the other time that don't just, pretend. Don't hide information from your health personnel. Don't. Then, what do you want to do again? You have to prevent further bleeding. Preventing further bleeding includes practicing safe sex. You can also use condom or other barrier method during anal sex to reduce the risk of sexually transmitted infection and bleeding. And of course, when you want to have anal sex, you should use plenty of lubricant, water-based lubricant like KY jelly, silicone-based lubricant. Most of the time helps in reducing friction and of course prevent tearing of that particular area. Then of course you should be able to communicate with your partner. If you are going through any discomfort, pain or bleeding, ensure you discuss with your partner to ensure a safe and enjoyable sexual or anal experience. You understand? And I want you to know when it comes to anal sex, bleeding after anal sex can be a sign of an underlying issue, which can be maybe anal tears. It can be sexually transmitted infection or other health concerns. So, my friend, my dear, if you experience persistent or heavy bleeding post anal sex, seek medical attention promptly. Remember, sex is beautiful, but you have to practice safe sex and take care of yourself. See you in the next video.